Good afternoon, everybody. This is Pat with the Colorado Gerontological Society. This is our third-part series on resident rights and restrictions. We're going to concentrate today about what you need to do for starting by September 1 and work that you've got to do over the next few months with all of your residents, making sure that you have good service plans, all the required assessments, and that you've got everything working correctly. So we'll get started here. All right. This came to me a couple of days ago. I thought it was awesome. And you forget sometimes about Walt Disney, but he started from nothing and he built an empire. And one of the things he said is don't quit, keep going and get the work done, because it will pay off eventually. So as a reminder, we have teams. So not only you as the administrator, but you may have several different layers of QMAPs. You may have separate layers of operations, kitchen management, maintenance, and you need to have a really good organizational chart. And so remember that assisted living now is a formal business and no longer the mom and pop management company concept. So you got to modernize and catch up. So today I want to talk about a few things. We're going to review some stuff that we talked about in the last video on resident rights. I want to talk about some new methodology of how to handle rental agreements and service agreements, and then where are we at the moment on rights restrictions. So let's go over some topics that we have talked about in other meetings. And just a reminder of these are very trendy and very national topics in all of healthcare and many other businesses besides. So inclusion means that anybody in the community that lives in the community could be a potential resident, and that we need to open our hearts to different kinds of people, different cultures, different sexual preferences, different work styles. Easier said than done. Equity is not only the whole thing between men and women, which is at jeopardy right now, but equity is also between races, education, culture, community, and that all the isolation and the social movements are really not valid. They're small groups of people trying to powerhouse other groups of people. So equity is a huge topic in everything that has to do with government and healthcare. Diversity means that it's very important that we are doing things that are for the whole community, and that we are diverse in our patient populations, and that we don't redline anybody out. Community engagement means that we participate in the community at all levels, from the local up to the federal, and that we're very conscious of civic and social terms, from city council, county speakers, county boards, school boards. For the first time in my whole life, I've never seen as much transparency about what's going on at different levels, and that especially in city council, and city councils are changing rapidly. So let's look at some more concepts, okay? One of the concepts I want you to think about is, what's the difference between protective oversight, which is in your job in Chapter 2 and in Chapter 7 under administrator role and responsibilities, and then in APS, hospitals, jails, blah, 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 least restrictive environment. They're very different topics and entities, and we have to start finding the middle pathway, because in our industry, we're getting caught right in the center here. And then when things go wrong, we get cited, and when things go right, we don't get credit. We also have to move towards a very important concept of person-centered care plans. So we've had a lot of canned programs out there by different agencies and different software companies. Canned programs are literally going away, and they want very person-centered and resident-driven care plans. So you may have some canned programs that you're going to have to find a way to person-centered and resident-driven. Some other terms that I want you to be reminded of you is attestation. That's a signature of acceptance. And boy, this is huge since COVID and all the fraud that happened in COVID, billions of dollars of fraud. And so attestation's front and center. Codification it's the law. It's in the statute. Therefore, there's no argument. There's no workaround. There's no gray zone. Where regulatory has some gray zone. So it's interpretation of statutes or laws. Chapter 7 is interpretation. Chapter 2 is more law driven. And so sometimes there's some negotiation within regulations, and a lot of change happens all the time. So we don't have to go back to the drawing board and pass everything by a majority vote. And then corrections. So we're seeing more and more corrections go out in the communities, and I'm working through different entities. Recently been working, yesterday worked through a labor one. I've worked through OSHA one, CDC, CDPHE have been in my plate for several years now. And they're all centered around worker safety. So when you're doing plans of corrections, one of the conversations in those plans of corrections is how are you protecting your residents? The other conversation in your plans is how are you protecting your workers? So let's go in the other concept. So we've had a lot of trends for the last 5 years in social work, in social media, social work, different government agencies, human services, all that. And it's all about residents matters. And so one of the things, even if you don't take HCBS or you don't take the state Medicaid plan to pay for residents' care, these concepts are good for no matter how people pay you. And so I'm hoping that you will take some of them and use them for all residents in your community. Okay. So who are our residents? Well, they come from a lot of places. They may have different socioeconomic backgrounds, different work histories, different communities. We're having a lot of people moving out of Colorado. At the same time, we're having families bring their loved ones to Colorado. So I've helped quite a few families in the last 6 weeks talk this through and get that first base accomplished. So they become Colorado residents, and then we can look and see what benefits they may actually be eligible for. So all cultures, all colors, all faith, all religions, many, many different things were happening. So let's think about and come back to our base or our drawing board. The first question, when you get a referral, you need to ask yourself, why do you need to live in assisted living? It's a very small portion of people that choose to live on assisted living on their own. The majority either have circumstances or people, influencers or legal influencers that encourage them or help them make that decision to move. And one of the big things that Adult Protective Services used to do consistently, was to figure out if people were safe or not. Now they're into the least restrictive environment, and that's kind of backfiring on them. So there is a national talk that our agency's been invited to the table to put input in of what the APS of 2023 needs to get to, and we're pretty much voted to get it back to dead center. There should not be paid detectives for the police department. That should be police work, and they need to be taking care of the public and the families and helping them to decision making. So it'll be interesting to see if we can get back there. Okay. So as an administrator, you have a significant role in the industry. You're the pivoting point. Okay. You must show really great leadership. You have to set the tone. And your staff are going to mimic you. They're going to mimic what you say. I see it every day. And they're going to respond to how you respond to redirection and goal setting and making sure you have your deliverables done. So in the organization, I want you to think of two silos. One of them is the legal silo. Where do residents fit sometimes? Is the probate court involved? Is attorneys involved? Does the resident have a handbook? Do they have their rent agreement, which is the money side of your agreement? And do they have a separate service agreement, which is the two things we have to change up? We can't do 130-page agreement anymore. Those have been pretty much tossed out in evictions. And so the rule of thumb from the feds is it has to be in 7th grade English, has to be simplified, and has to be understandable and executable. And so you're going to see a lot of push to take great big huge legal documents and bring them down to the real people. Okay. You need to have some assessments done. This could include if your resident smokes, what's their risk assessment for a fire evacuation? What's their elopement assessment? What's their fall risk assessment? If they want to cook, what's their ability to do so? What's their activity or resident engagement markers? How's the family doing? Are they engaged, or are they just demanding and trying to take control and put impossible pressures on everybody around them? And that happens a lot with families. And then the big one is the cognitive and behavioral assessment. And the name of that form is called FAST. Been using it for about 8 months. And these are done by neuropsychiatrists or somebody on the team. And they do this assessment. So it's not just a scum anymore, which residents tend to memorize or get irritated about asking the same questions. It is a comprehensive assessment to really try to stage people in where they are in their cognitive abilities. And stage 4 is the worst of dementia, where those folks need to be in skilled care. And stage 1 is early. Is most of our assisted livings folks that have some sort of behavioral issues, such as depression, isolation, true mental health disorders that are diagnosed, bipolar, schizophrenia, that type of thing. Or do they have cognitive or a combination of the two? So let's look about clean up your timeline a little bit more. I've been working with some facilities to do a pre-admission assessment formally and keep those papers, and because families may come back within 60 to 90 days, and then you can just update them. And so I would encourage you to have a tool to do that, phone inquiry, and capture information that you need to know. Okay. Then if you, after a tour, and they decide that, your place would be a good place, then you want to start your referral review. And so your pre-admission assessments, and again, same things we've been talking about, behavioral, physical, social, mental health, and ability to pay. Okay. And so the first day, and you're going to do some of the work before if possible, but your first day, you're pretty much doing the coordination of services. So you're not going to really get a service plan really started. You may have some ideas on it, but it won't formalize for a few days. And you're going to do another tour and help people acclimate to the community. I like peer tours because they're slower, and the peers can tell people little stories and about little places where they can sit or where the best sun is in the afternoon. And so I think peer support's a really good way to help new residents settle in. You want to introduce staff. Staff should definitely introduce themselves by name and what they do. And then you want to help them start settling in. The first day is wild and chaotic, like any move for anybody. And so don't expect anything particularly beautiful out of your people on the first day. Your first 30 days is what we call the adjustment period, and you're going to be making a lot of course corrections during that first 30 days. You already do it, and it's natural. You just don't capture it on paper. And then I need you to re-coordinate in 6 months and then annually. You no longer can just do it once a year, and there is facilities that haven't done it since the first day they moved in 5 years ago. So you must have, by regulation, an annual minimal, but in reality, you need quarterly and 6-month updates. So the new trend for financial, Colorado adopted this because of all the fraud that was going on. And we have a state form that is statute, so you're protected. Nobody can tell you use the wrong form in court, and that you can't evict when you don't get payment. Today we got a letter from HCBS on PACE clients with some of the same conversation in it. So if you have a PACE client and you don't have the letter, email me and I'll send you over the document for your policy book and for reading and executing. Okay. You also want to do as much auto deposits. If you are collecting rent as an auto deposit, no matter what that rent agreement part is, whether it's a petty or it's a full fee, whatever, try to put it into a separate bank account that's only for deposits, and then you remove the money. It does nothing else. You need to protect yourself. There's fraud in banks every direction, and you need to protect that money because people could go in and scam it and take the whole thing out, and you have nothing to work with. I don't want them in your regular banking system in any way possible. So in your rent agreement, there's some parts that are super important. When's the due date? So a lot of seniors get paid on a Wednesday. and it's alphabetical, and it's usually the first, second, or third Wednesday of the month. People on SSI get paid on the first. People on old age pension get paid on the third. Retirement plans pay different dates. So the due dates can be very important. You don't want to set somebody up to fail before they even get started with you. Very clear amount. And then a service fee if they're non-auto deposit. The banks are now charging $15 to process a check, and you should not be holding that $15 fee. That will be a service fee that they could take out of their allowance, or they can pay out of their regular funds, or the family can pay if they don't want to do an auto deposit. But we're getting more and more people moved over to that. If people have legal authority, whether it's financial, fiduciary, conservator, or power of attorney, please make sure you have the correct paperwork and copies. And then if they're court-based, make sure you have the court agreement and you know the parameters. Read them carefully. Sometimes the court's very broad stroke, sometimes the court is very specific stroke. So let's talk about this transition period, okay? We basically see three kinds of situations going on. We have a really, what we call an acute adjustment phase, where folks are very sad, they're crying, or they're very silent, or they isolate and they don't want to engage in anything. And they're calling their families, come get me. They're really not adjusting well, and they need a lot of one-on-one support to come around the curve and be a part of a brand new community and a family that your agencies are. Others adjust really fast and they do quite well, but that's not everybody. Then sometimes we start seeing behaviors, and I get calls about this intermittently, where the family member who never saw this behavior at home is all of a sudden yelling at people, very demanding, hitting people, acting out, trying to elope, hurting themselves. And so I get calls from families, now what do we do? And we talk it out, and then they work with their primary care teams and try to see if they can calm the waters. A lot of time it's fear. Sometimes it's low vision or low hearing or new white noise. So like in my house, I know my white noises. But if I had, when I go to a hotel, I'm traveling, I can't sleep because I don't have the same white noise. And I think it's very similar to when people move into new communities, that white noise could be different. So it might be a way to help people adjust is by understanding what their white noise was in their home and see if you can replicate it in their new home. All right, so private pay. On the private pay side, the resident has a lot of leverage. On the state program, the waiver has the leverage, and neither are always in your favor, okay? And so the private pay, the resident can negotiate. On the state program, it's more black and white, but the important language that came out this year is that you have to work on privacy, dignity, respect, and allow as much freedom as possible. And so you are not their dictator, you're not their parent. And again, we hit those gray zones, and then all of a sudden you're cited for not providing protective oversight. Who are some of the players? Again, some new words, new concepts, but things you've been doing for a long time. Who are the influencers? Who are the decision makers? And now we have higher trained case managers in the single entry points in behavioral health that have a higher level of deliverables and responsibilities. And they're going through what we call case management redesign. And then they have competencies to pass those to keep their jobs. And so we're going to see the case managers needing more information, having a better communication and more feedback loops with facilities. And the same thing's going to happen in the courts, and the same thing's going to happen in lawyer offices. So this whole new case management redesign, communication, relationships, legal, semi-legal, all of the different kinds of paperwork are going to get more and more formal, and I don't think that's going to go away. So let's talk about what's in a service agreement. So we have the Colorado rent agreement for the amount of money, and that's standalone. And if they don't pay it, then you can eat, it's a lot easier. And then you have what we call a service agreement. In the service agreement, you have to have two levels of services. So you have your core services, which you've been doing every day for a long time. And then you have your enhanced services, which makes you stand out from different facilities. And why do you want to live here? and what does this community do, and how do we meet your needs better? And so it's a lot of it is these topics are your marketing topics as well. And so how residents perceive the staff, and if there's a lot of turnover or staffing agencies, they tell me how much they hate that, because they want those personal relationships. If they go to the hospital, how are they treated when they come back? How does it work with home health? What's those coordination of services that direction? If things change and they need more one-on-one care, how do we rewrite the service plan and do an update? And it may be a fee increase. So you may have a base fee when people are more ambulatory self-care, and you may have several layers of fees for people when they need more additional services. On the behavioral health side, again, we're in a total rewrite. And Colorado was at the bottom of the totem pole for mental health and behavioral health in the country. And so we're working back up. And so some of the big topic items is that residents need to have goals that are under the MI waiver, or live in your home for early dementia or behavioral health support. Okay. And we need to make sure the resident weighs in as well as the family. And these were some quotes that I've gotten from families in the last couple of weeks, and from all the way from high frustration to high praise, and thank you for all the work you're doing. And so I want to come down to actually what I wanted to talk about the most today, which is rights modification. And what does that actually mean? So first of all, we have to do some more training with our staff. They've got to learn some simple motivational interviewing techniques. They've got to learn redirection measures, diversion measures. So if somebody is having a bad day, we get them onto a puzzle, or we get them coloring, or we put music on, get them watching a movie, take a walk, and redirect negative energy into positive energy. We need to make sure people's time is full. So when I go into a facility and it's only TV, meals, and sleep, that facility is dead. And having really good activities to meet the needs of the residents and the age group of the residents is not easy. I have found people that worked in the hotel industry do a pretty good job of being activity directors and seem to be comfortable with it. They like that coordination. A lot of good listening and a lot of compromise. So when staff lose it and they put their parent or adult voice out and the resident responds to it very negatively, it's on the staff, it's not on the resident. The resident needs, and that's our responsibility as a agency, redirection. They need to have some adjustment time. They need to have kindness, and they may need professional help. So we may need to coordinate the crisis people. We may need to coordinate behavioral health appointments. We may need to coordinate MAT or SUDS for substance abuse. So again, all of your work is taking a new focus. Okay. So sometimes we need, we want to put a rule out. And I've been in homes where there were 30-some pages of house rules, put them in the trash can. We can't do that. We have about 5 or 6 that we can get away with. And the big thing is that house rules are for everybody, okay? So your assessment before they come in, you've got to answer that question. Why do you need to be here? And what's in it for you and what's in it for us? And so this is part of this work that you have to work yourself through. And when you take state dollars, you really got to work with that case manager. And when I ask case managers, why does this person need assisted living? And they can't answer it, I send them back and say, when you can tell me what the storyline's about, then I can probably help you find the right facility, because I really try to match residents to facilities that will support and enhance their lives and not just be filling a bed. So what do? Residents acting out, you need to make clear in your head. It's not a one-time situation, it's a repeat situation. You've sat with the resident, you talk about it, you get their feedback, you talk to the staff about it, and you adjust the service plan to say this really works when somebody's upset, and this is what they would like to do or prefer to do. And then they use that as part of their documentation in their task list. So they had an outburst, and then we have in the task list interventions, and they just click the box, and therefore they're not doing a lot of writing, which the population of people that we attract to this business, writing skills for many of them is a real hassle for them to do any writing other than check boxes and initials. The case managers in this new case management redesign, and for those of you that got the PACE memo, you're going to see this all spelled out, so it's even better than what I've done. And they are responsible for the legal, social, and behavioral health, so that if a resident is having a hard time living in a facility, they can look for another facility, but they cannot circumvent the regulations. I've had that happen recently, where the family was insisting that a loved one needs to be in a locked unit, and she did not need to be in a locked unit. And the family insisted on moving her, and therefore it caused me, because as a professional and a mandatory reporter, I needed to notify the courts, and I needed to notify other entities that this person was put into a locked unit against, and she did not need it. She did not require it or have the paperwork to require it. So no longer can a doctor write on your admission dementia. We have to have the layer of dementia, the impact of dementia, and is there any psychiatric disorders to go along with it. So doctors are also being pushed to be more accountable. So house rules. Remember, house rules should be as minimal as possible. My favorite house rule, and one that I use two. One is all residents will treat each other with kindness and respect, to bring back that old school that they've grown up with. This population you serve, this generation you serve, they're used to that one, so I use it. And the second one is that we have a no smoking within the facility, and we have a no substance abuse on the grounds. No substance abuse, no marijuana, and no meth, no fentanyl. So it's really simple, clear English, and enforceable. And when people break those two rules, they can be cited for discharge and be asked to go find another facility. We had a facility here in South Aurora that was allowing people to do anything and everything they wanted, and with a lot of pressure against the state, they are now closed. Because again, it wasn't protective oversight, it wasn't meeting the needs of the residents. It was a free-for-all collecting the money, and they were only feeding them once a day. Okay. So here's some other house rules that don't work. TV off at 10, can't do that. Okay. Residents are not allowed in the common areas and from a certain time frame to a certain time frame. The house phone can only be for business, not for a general conversation. Can't have snack or foods when the regulation says that food will be accessible 24/7 along with beverages, unless they're on a specific diet for a specific disease. And this is especially important in the host homes. And so we had to push the state to come back to some common sense. It doesn't mean that we're serving breakfast at midnight. It does mean that there are some accessible snacks and available to eat, just like you would in your own kitchen. So I want you to review some sections in Chapter 7. So remember, review Chapter 11. The work that we are starting in September, we've been a part of this all year, and we've been talking it out again here in the office, is Senate Bill 22-154. And literally, the legislator wrote in the middle of the bill to kick residents out. And so the health department's taking that bandwidth, and they're going to start meetings in late September and start trying to put more regulations around that statute. Very concerning. I've been thinking, not going anywhere, but thinking about how to get this whole stupid bill repealed and get it rewritten to the reality, because there's good parts in the bill, but kicking residents out is not one of them. The second section, I really want you to go back and read, and I want you to take your service plans, your policies, your staff training on resident care services. And this will be another short that I will tape, and it'll be in the drop in September. It's got a 3-part series as well, as like this one did. And it's all about the new service plan and how do we use mediation as a tool to make our homes safe and happy and workable, and that groups can live together. And so make sure your service plan is open and honest. Make sure your interventions are successful, and they're not, revise them. Don't throw out your old ones, but just put a single line through, and initial, and then a revision if they're paper, or same thing if they're electronic. Look at your electronic system. Do not throw out the old, because what you're showing is we've tried this and this, and we did it for a reasonable amount of time, and these are the changes we made, and these are the behaviors we have. And so there's going to be a real important reason for all of this and this connectivity. Okay. Section 13, we talked a little bit about it, talked about it the last couple of days. Make sure your resident rights are verbatim out of Chapter 7. You give them on admission, and they're in the resident handbook to the families, and they're in the resident center, and the staff all have them and have signed an attestation that they have had training on them, they understand them, and they will uphold them. So it's kind of like when you agree to be a witness in a jury for a jury trial, and you put your hand up to the judge and you swear that what you're telling is the truth and nothing but the truth. We're in the same spot right now, is that we are going to have to clean up our act, and we have to walk the talk. All right, so you're out of time. And HCPF is, it doesn't matter how you get paid. Resident rights and rights restrictions are here. They're right in our face. They start tomorrow. And so you got to make sure that your plan for your home, your service plans, all are in alignment. And you may need to talk it out. Some people in the industry have helped to solve some of the problems we've been able to share with other people in the industry. And we've come up with some solutions. And we are at a very short, limited time where the state will be visiting all homes and for these tools, and then they'll be reporting up to the feds. And this all has to do with licensure. Okay. And then the other part of it has to do with keeping the HCBS money flowing into our state. So lucky for us, we're looking pretty good in Colorado. Majority of Colorado has complied, and they're doing some fine tuning, and then they're going to hit the private side and start making sure that the private side is in compliance. Okay. On the fourth Thursday of the month, I believe it's around 1 or 1:30, there's going to be a meeting for 2 to 3 hours to work on modernizing Chapter 7 again. This is the form that you need to sign up. Please, I think, as far as I understand, they're hybrid meetings. And Eileen and I were just talking about whether we should split up and one be there and one be here and be right in front of their face. That was very successful last time, to be right in the front row, and they could not ignore or try to do workarounds. And then I challenged the board that none of them that are on the board that work for other agencies can be a board member, that it only can be the industry, and they can be consultants to the board. And so I'm going to push it again, because I truly think the board is made up of favoritism. And shake your head, and yes, I agree with you. I've sat on a couple of those boards, never again. And I want to see if we can change this board back to the working people, and maybe a couple of residents, maybe a couple of family members, and make sure it's for the whole state. So it's we Colorado, and not the favoritism group that has been on the board for some time. So in summary, be consistent in your pre-assessment, understand your residents' strength, build cohesiveness, okay? A dysfunctional admission will totally disrupt your operations in your home. And an eviction costs you a ton of money. It's going to cost you more, because you won't be able to evict on your own. You're going to be having to submit paperwork and a hearing at the health department for all evictions, minus the rent eviction, which is because you're going to be protected under that statute. And that's why we're going to split this thing up and take care of our businesses, okay? If you happen to hire dysfunctional people to work for you, or you're drawn to dysfunctional people, you need to think about this. And you don't want everybody to say yes to you. You want people to be thinkers and learn how to bring conversations forward and have collaborative thinking about how we can make our home a community. And so your staff and your residents are a major part of this, and you'll be happier in the long run when your people are happy. So there's an old saying that my father used to say, is if your mother's happy, I'm happy. I'm going to say that to you. If your residents and staff are happy, you will have lemonade and you won't have lemons. And if your wondering about the pictures, those are off the new Webb, the James Webb satellite. I've been watching that every day. I've been fascinated by it. And those are pictures from the last week of planets where it's been and some of the galaxy work it's doing. It's super fascinating. And I think it's actually very interesting that we're in a major rewrite in our industry, and the space exploration is in a major rewrite. So thanks for attending today. This will be on our YouTube channel. Feel free to watch it as often as you need. And as always, email, pick up the phone. I'm glad to help you talk out anything. So thanks for attending today. Have a wonderful day. And we will be putting these in our YouTube, and we will be putting some more in September.